earlier. Now, the previous unit that you have done is HLT-INF-001. Some of you would have done HLT-INF-001, but that unit is no longer there. So they have the government has updated it, and they have requested all colleges to follow HLT-INF-006. So the unit that we're doing today is HLT-INF-006, not 1. Okay. So
good morning, sir. Sorry for late.
That's okay. So I repeat myself. So the previous unit was HLT-INF-001, which is no longer valid. Now you're doing HLT-INF-006, which is the correct unit that you need to have for this course. And that's the reason some of the students have rejoined this particular unit. That's the purpose of the unit. Now, I still see students joining in. This is exactly what I don't want. 9 o'clock is the time that you have to attend your session. You join the session is 9. Okay, so today's session we'll try to finish by 12, 11:30 or 12, but I'm guessing that we'll only be able to finish by 12. So let's see how we go. And coming to the next one is this particular unit has a face-to-face session. All right. So when it comes to your face-to-face session, which is tomorrow, just have one more student joining, guys. All right. So when it comes to your face-to-face session tomorrow, so I know that last week I was mentioning time of 10 o'clock. Please listen to me carefully. But because of huge numbers, I do not want to have 100 students in my class. That's going to be trouble for the student and also for me. So that's the reason I am moving this particular session to 1 p.m. 1 p.m. to 3 p.m. Is that clear? 1 p.m. tomorrow, 1 o'clock until 3 o'clock. Now, any student who has issues or concerns in regards to time, you cannot say that I cannot attend this, session. Well, I have already mentioned that keep your Sunday for next week. You have to come to the college. So it has to be a session, a face-to-face session on a Sunday. I have mentioned it last week already so that you can be organized. And a lot of other students have also received emails in regards to this. But in the email, I would have mentioned it as 10 o'clock. So 10 o'clock, I have another batch coming. There is already a big batch. So I don't want to club both batches. I thought it's going to be less students, but apparently, it ended up with 120 students. So I had to split it now. So it's 58 students in this class. So tomorrow from 1 p.m. to 3 p.m., I'm expecting these 58 students to join the session. Now, you might have difficulties with the front door at the college, because sometimes on a Sunday, what happens is it's usually closed, the downstairs. The lift has access, the college is open, but sometimes the downstairs door is auto-locked, so you need access. So in order to give the access, what I'll do is around 12:45, 12:50, I'll come downstairs to pick up the students. So, and any student who comes after, well, you have challenges to come upstairs. And once I start the session, I do not expect people to come in, as they are coming in here now. Okay, like see what there's another student who's coming in now. So this is not something that I'm expecting tomorrow. So face-to-face session, once I start, I do not want to be interrupted, or I do not want to know any reasons behind transportation, some people, 1 o'clock, guys, you can be very well prepared. Okay, you can check online if you have any interruptions with your transportation. Make sure that you are well prepared. Okay, try to reach there by 12:30 if you can, to be organized. Is that clear for everyone?
Yes, sir.
Now, I do not really want to discuss too much about this again, but just for those students who have just joined in again, your session starts at 9 o'clock and you're expected to be here at 9. And again, if I see that some students are not being on the camera and they're not attentive, they will be not provided with the assessment or will be questioned. tomorrow when we meet face to face, because having enough knowledge on this unit is very important. If you do not have enough knowledge on this particular unit, you might risk yourself or other people in the industry. So I do expect people to really be attentive in this session. And I do not want anyone driving, as I mentioned earlier, so that, you know, I do not trouble you. Okay. We don't want any troubles. We just want a very smooth session. Okay. Now, Bandana, you have joined in very late, and I do expect you to be here. Bandana.
Yes, sir.
You have to be, you already came late and you're not on the camera. Can you please come onto the camera, please?
Yeah, okay, sir.
Yeah. So again, I repeat, so you must come for this one face-to-face session, 1 p.m. to 3 p.m. 1 p.m. to 3 p.m. You must come for this face-to-face session. And you may either bring your laptop fully charged. Obviously, we don't have 60 ports to charge. So fully charged, or you can bring a hard copy of the assessment that I'm going to provide to you today in this session. You should either have the hard copy or you should have the laptop where you can record and provide me with the information. Okay. I hope that is clear for everyone. Now, coming to this mandatory session tomorrow, if you miss it, guys, the next session, I don't know when it's going to be. We're looking at in about 2 months, 1 month, I don't know, because, you know, if a unit gets repeated in 13 weeks time. Okay. And I do not expect anyone to miss on that mandatory session. Then later on, you're having troubles to complete the course. And you have to blame yourself for that, because obviously I'm not taking a session on a different day. This is your scheduled day, Sunday. Is that clear for everyone? Any questions from anyone?
It's tomorrow, sir, or next week? Tomorrow, yeah?
Tomorrow, the 7th of May.
Is it possible that I can join the morning session?
See, that is something that I'll discuss at the end of the session, Gemma. So you can discuss with me about that at the end of the session.
Okay, thank you.
I do not expect anyone to rock up at 10 o'clock. Okay, because that's not your allocated session. You need to have an approval from me before you do that. Okay, and anyone who has questions about that, I'll discuss with you after the attendance, and do not interrupt in between the session asking for these timings. Let's be a bit more organized. Is that clear for everyone?
Yes, sir.
Yeah.
Yes.
And it doesn't matter whether you're coming from Ballarat or from Sydney. Okay, I don't want anyone giving me excuse that I'm coming from too far. Nothing is too far within Melbourne. Okay, so you have to, 1 o'clock is out. You have plenty of time to reach there on time. I hope that is clear for everyone. Now, so today's unit is a unit, and we do have some new students, I believe, today. So new students, please make a note that you're starting this course with unit number 13. And from next week, you're going to have unit number 1 and so on. So once you get to unit number 12, that when your theory part of the course completes, and then we'll look into your placement. So this is for the new students who have joined in today, very first day. Okay. All right. So let's get started.
Excuse me, sir.
Yeah.
Can I log out and join in again?
Yeah, sure, you can. So, all right, guys. So this is your unit number 13, which is HLT-INF 006. Apply basic principles and practices of infection prevention and control. That's your unit number 13. Apply basic principles, practices of infection control and prevention and control. Now, in this particular unit, obviously, we'll be learning about infection control, and the purpose of the unit is, everyone knows the purpose. Obviously, when you're working in the health industry, in an aged care industry, to specific to your industry, aged care, you will be coming across different infections that are communicable, which means they can transfer from one person to another person. So how do we control this is what we are learning in this particular unit. Now, there are different Australian standards that we have to follow when you are working in the industry. Some of these standards include the National Standards and Guidelines, Australian Guidelines for Prevention and Control of Infections in Healthcare 2019, and the Australian Commission on Safety and Quality in Healthcare, which are released in on a specific reason, which is COVID-19, and your own state and territory standards and guidelines. So these are the different guidelines that we follow when it comes to infection control. And talking about this different standards and guidelines, now how do I follow these? Now, most of the standards and guidelines are already embedded into your policies and procedures of the organization. So in the organization, the policies and procedures will clearly state what to do and in which different situations, okay? Depending on the circumstances, you will be following different infection prevention control measures. So these control measures are already documented into the policies and procedures, and you have designated people who will be able to assist in case of an outbreak. When I use the word outbreak, what it means is there is an infection that is communicable. Then we call it as an outbreak, okay, in an aged care. Now let's move forward with the next topic. Now, when we're talking about infections, we have to learn about colonization, infection, and what is a colonization and what is an infection and what is a disease. Now, colonization means basically a microorganism might sit on a surface of the skin, where the person might be colonized, but he is not infected, okay? Or it could enter the body, but it's not doing anything to that person because he has a stronger immune system, but he is considered as colonized, which means that this person can be a carrier of infection, which means the person himself is not affected because of that microorganism, but he might transmit to another person. Is that clear for everyone? A person is said to be colonized because the infection has entered into the body, but it's not doing anything to the person. He doesn't have any symptoms, but that person is still passing on that particular infection to another person, where the person is said to be as colonized, or this process is called colonization. Is everyone clear with that? It might be on the surface of the skin. It might be inside the body of the person where it's not affecting the person, but the person is said to be as colonized. And this person is actually infectious because he can still transmit the infections to the other people. Infections. Infection is a state in which microorganism invades the body and multiplies. The affected person may be asymptomatic. This is an infection without symptoms. It is sometimes referred to as inapparent or subclinical infection. At this point, action must be taken to control and spread the infection. In both situations, colonization and infection, where a person, again, he's infected, but he might be having few symptoms or may not be having symptoms. In those both situations, the person can still transmit the infection to another person. When this infection enters into the body and it's affecting a person and the person becomes sick, then it's called a disease. A disease is when the infection has damaged the cells of the susceptible host and the person feels unwell. When someone gets sick because of the infection, the process is called a disease. And who is a susceptible host? Susceptible host is people who are more vulnerable to these kind of diseases. For example, a person who is elderly. An elderly person is said to be a susceptible host because of the age, because of the immune system, weaker immune system. They are said to be as susceptible host. And any person with, for example, people who have diabetes or people who might be diagnosed with cancer, people who are on chemotherapy. So these kind of people are said to be a susceptible host. In other words, they can easily get the diseases or infections because their body is not strong enough. Is that clear for everyone? Susceptible host is someone who can easily get an infection because of their health condition. It could be because of their weaker immune system. It could be because of their age. It could be because of their, pH levels could be too low, and they can acquire these kind of diseases or infections very easily. They are said to be as susceptible host. Is that clear for everyone? Now let's move on to the next one. Now, when we're talking about the chain of infection, we have 6 links in the chain of infection, which are infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Now, when it comes to infectious agents, we have bacteria, viruses, fungi, and parasites. These are all referred to as microorganisms or pathogens. Now, because of these, we might get different infections or diseases. Now, reservoir of infection. The infection reservoir is the host that allows the microorganism to live, grow, and multiply. For example, a bacteria enters into the body and it multiplies. So reservoir can be anything. It could be a vector. Vector, when we refer to as vector, it could be a flea. It could be any kind of bug. All right. It could be any kind of insect, animal. They're all said to be as vectors, where a microorganism can also multiply in the body of an animal or an insect. They are referred to as vectors. The host can also be us, human. Okay, they can also multiply in human. And some of the reservoirs are people, animals, birds, equipments, objects, blood, body fluids, food, water, soil, waste. Now, these are all reservoirs. Now, we did discuss about these and these, but yes, reservoirs infections can now also grow on equipments, objects, blood, body fluids, food, water, soil, and waste. These are all said to be as reservoirs of infection. Now, what is a portal of exit and portal of entry? Now, portal of exit, when a person is Bandana, I'm not going to repeat anymore. You'll be removed very soon from the session.
Sorry, sir. I have some problem for today, so my mobile is also going to be down.
Yes, so you might have to join the next session whenever it's available, Bandana. Yeah, all of you, please be prepared with your sessions, guys. Either your laptop or your phones, whatever you're using, be prepared next time. Now, portal of exit. Let's learn about the portal of exit. Now, when a person is infected, how can it transmit from that person to another person? What is a portal of exit? In other words, how does the microorganism move from one person to another person? What do you think? Any answers? Portal of exit.
Blood.
Body fluids, yes. All body fluids. Yeah. For example, someone has touched their blood or saliva, and then they have touched someone else directly. Okay. Now that is a portal of exit. Here is blood could be from a cut, or from a body fluid, whether
Sneezing.
it's urine or anything. Yeah. What was the next one?
Air droplet.
Air droplets. So air is also one of the portal of exit. Now we do have some portal of exit examples here. For example, respiratory, coughing, sneezing, talking, elementary, vomiting, diarrhea, saliva, genitourinary, which is basically a sexual contact, skin, open wounds, transplacental, from mother to fetus, which is unborn child. Okay, so these are all said to be as portal of exits. Apart from this, I believe under respiratory system, Under respiratory, we have the air as well. When a person breathes in and out, which is basically airborne. Okay. These are all said to be as portal of exits. Now, sometimes the portal of exit and the portal of entry could be the same. Portal of exit and portal of entry could be the case, could be the same. Now, when we talk about the portal of entry, how does this microorganism enter into another person? How does the transmission happen? Now, the exit, everyone clear with the exit? Is everyone clear with portal of exit? When a infected person transmits the infection to another person, how does this transmission happen? Basically, when a person is talking, the droplets are falling. They touch saliva, they have open wounds, they have blood, they have vomited in the wash basin, and you have used that wash basin, and it somehow fell on your hand, and then it entered into your body through your mouth, or so on, nose, or any open cuts. The portal of exit and portal of entry sometimes can be the same. Most of the times it's the same. For example, say a person was talking and the droplet fell. We don't know. It might be probably has fallen on your hand, and for some reason, maybe you're eating or you might be touching your mouth or nose, then it has entered through your mouth. That's called portal of entry. Is that clear for everyone? Now, this portal of entry can be, I'll keep it very simple. For example, someone has used a toilet in public toilets. Okay. Used the toilet. This person is infected. All right. And you went and used the same toilet, or the person who is not infected has used the same toilet. All right. But they did not clean it. Now it could even enter from there as well. Is that clear for everyone? The portal of entry and exit could be the same. Sometimes it may not be the same, but still the person can be infected. I hope that is clear for everyone. Portal of exit and portal of entry. Now let's move on to the next one. Now we have direct transmission and indirect transmission. Now, what is a direct transmission? Now, when we're talking about this portal of entry and exit, that's what we are discussing about, direct and indirect transmission. Now, direct transmission is when a person is standing close to each other. For example, in COVID, we had this 1.5 meter distance. Why did we have this 1.5 meter distance? Can anyone tell me? Why is it not 2 meters? Why is it not 1 meter? Why is it 1.5? Any answers? The reasons behind that is because when we talk, our droplets may travel up to 1 meter, not beyond that. Okay. So that's the reason they said you have to maintain 1.5 meters so that the droplets don't fall on you or the transmission does not happen. Is that clear for everyone? Now, this is basically a direct transmission because you're having a face-to-face contact with this person. You're having a face-to-face contact, shaking hands, hug, or a kiss, these kind of things can cause direct transmission. Okay. Now, what is an indirect transmission? Indirect transmissions include a transmission through an intermediate object, a transmission through air, a transmission through a vector. These are all said to be as indirect transmissions. Now, what is an indirect transmission? I'll give you an example. Now, for example, I'm infected. Example. Now, I touched my cup of coffee or bottle of water and had my water. And I had some microorganisms sitting on my hand. These microorganisms are now transferred onto the bottle. And someone has touched the same bottle. All right. And then they touch the mouth, nose, or so on. Then it enters into the body. Is that clear for everyone? That is an indirect transmission. Indirect transmission through animals, fleas, birds is also said to be as indirect transmission. Any transmission of infections through birds, insects, fleas, they all fall under indirect transmission. Is that clear for everyone? Now, Another good example is doorknobs. Doorknobs, handrails in aged care, handrails are also very dangerous because all of the clients, they use handrails when they're walking. They hold on to the handrails. And one person has touched it and the next person is also touching it because it's in the hallway. Is that clear for everyone? Now, what do we do when it's indirect and direct? I also wanted to mention about another one, which is under indirect transmission, which is airborne. Now, let me ask you a question. There was a person who is infected in an aged care. In room number 1, this person is infected, okay? And this person has an airborne transmission, which means that transmission can happen through the air. Now, first question that I'm going to ask you is, under airborne transmission, do you think in order to get the transmission, in order to have the transmission happen from one person to another person, do you think they need to have a face-to-face contact?
No.
No? Anyone who says yes? Okay. The transmission can never happen. Even can happen even if you don't see the other person who's infected, because the transmission happens through the air. For example, there's someone in room number 1, someone in room number 2. They both open the door at once. They're both not wearing masks. Can the transmission happen? Yes, there is a chance the transmission could happen. Now, let me ask you another question related to airborne. The airborne is also indirect transmission, okay? It's not direct because there's no face-to-face contact. There could not be a face-to-face contact. Now, one of this client in room number 1 has been identified as having an airborne infection. Now, this person has been moved to the hospital at 9 a.m. in the morning. The cleaner goes into this particular room at 11 a.m. to clean and disinfect the area. Do you think this cleaner can be infected? Is there a chance of infection after 2 hours?
Yes.
Where the person is also not there?
Yes.
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 The answer is still yes, because these
Yeah.
microorganisms can stay in the air for longer period. They can stay in the air for longer period. If we do not wear an appropriate mask, now do you wear a normal mask or a N95 mask?
Normal max.
N95.
Do you wear a surgical mask or an N95 mask?
N95.
You definitely have to wear N95. The reason behind why we say N95, again, guys, it does not mean that we are 100% safe. Again, let me tell you, even if you wear it properly, there's a chance that the transmission can still happen, because the reason behind why they name it as N95, because it's only 95% accurate. 95% you're safe by wearing that particular mask. This transmission can still happen. And that's why in the hospitals, usually it is very safe. It's where 95% is a lot, so safer. But when they put the mask on again, there are different masks in N95, small, medium, large. You know that. Then it's not only just one standard ones, because or different sizes depending on. That's why in hospitals what they do is they actually have a particular training and test to identify which mask is suitable for a person. Okay, what they do is they'll ask them to put the mask on and they'll ask them to blow. If they can feel the air, that mask is not basically fitting them. So they keep changing the mask to see which one is the right one for that person. Because in hospitals, they deal with a lot with airborne infections, right? Is that clear for everyone? Any questions? Now we have this different transmissions, whether direct or indirect. Now, how do I prevent this and how do I manage it? Now, usually when you come across any kind of symptoms, in an aged care, let me tell you, in an aged care, you might come across MRSA, which is methicillin-resistant Staphylococcus aureus. It's you don't have to remember a whole lot. Just remember it as MRSA, because people don't say this usually in an aged care. They don't go like the person has methicillin-resistant Staphylococcus aureus. Rather, this is say the client has MRSA. Okay? Now, MRSA is a very common one that you may come across in an aged care. And the other diseases that you may come across, infections or diseases, like chickenpox, you may, tuberculosis, TB. And I'm just looking at the diseases to tell you. Scabies, gastro. Now, these are some of the direct contact diseases that you may come across. Direct contact diseases. Now, indirect is only basically the chickenpox and tuberculosis. Direct ones are basically scabies, MRSA, and gastro. These are direct. So you might come across some direct and indirect. Apart from that, you have COVID-19. And COVID-19 is both direct and indirect. It's face-to-face and also airborne too. That has been identified as airborne as well. So COVID-19 is also one of them you may come across in an aged care. Now, how do I manage when I come across these different diseases? I see symptoms. What do I do? If you see any symptoms, for example, gastro, usually people are vomiting, okay? And they have loose bowel actions, okay? Loose bowel actions and vomiting. And it is very smelly. So in those circumstances, you come across a client who is having more than once they're having a loose bowel action and they're vomiting, you need to immediately report it to the supervisor. Now, when you report to the supervisor, what they do is they assess the risk and they contain the infection. How do they contain the infection? They have the client to stay in their own room. And they start asking all staff members to wear complete PPE to prevent from transmission. Now, these, for example, I hope everyone is listening to me very carefully. Bandana, you might probably leave, my dear, because you might leave in between. I'm not going to still consider. So rather you can attend the next session. Now, I repeat myself, guys, if you come across any kind of infections or diseases that are transmittable in an aged care, you will report it to the supervisor immediately. And we will be also writing an incident report. And the reasons behind this is because they have to also report this to the Department of Health and Aging. Now, all outbreaks are to be reported to the department. Now, why do we report it to the department? Because the department is going to monitor closely to see how do we contain this particular disease or infection. Okay? Is that clear for everyone? Now, for example, once we report it to the department and after, say, 24 hours, you have another 4 cases. You have to report those 4 cases as well to the department. After 10 days, you have 15 cases. Now, the department is questioning themselves, hey, what's happening here? Let's go. So the department walks into the aged care. They'll check the practices. Are you guys following the proper infection control procedures? Because if you do not follow the proper policies and procedures, the transmission can be very quick. Are your staff having enough knowledge on how to contain the infection? Is that clear for everyone? Now, this is called an outbreak. Where there is an outbreak, if you're not able to manage, especially it's moving on from 1 number to 5 residents or so on, what they usual practice is, they'll ask all residents to stay in their own rooms. And they start delivering the meals to the client's rooms. They'll start having staff members to follow strict policies and procedures on infection control. Because these kind of infections and diseases can start killing people. And that is the seriousness of this particular unit. Is that clear for everyone? Now, when it comes to these different infections, I just gave you a little bit of information about outbreaks. Now, let's talk about how do we manage infections in an aged care. Now, when we're talking about the infections in an aged care, we follow standard precautions and additional precautions. We follow standard precautions and additional precautions to manage both standard and to manage both direct and indirect transmission. We follow standard precautions and additional precautions. What falls under standard precaution? Now, one other thing I wanted to mention to everyone is when we talk about infection control, guys, everyone in the organization is responsible to prevent infections or manage infections. Everyone, whether it's a CEO of the organization, manager of the organization, whether it's a personal care assistant or cleaner, everyone has a responsibility to manage infections. But your CEOs and the infection prevention team will be more responsible into when it comes to providing resources. You have enough gloves, masks, and so on, and regular training. They're responsible for that as well. Okay, which we are not responsible. We are responsible to attend them, but scheduling them is their responsibility. Now let's look into standard precautions. What are the standard precautions? Standard precautions include hand hygiene, which is washing your hands and sanitizing your hands. Use of PPE, which is gloves, mask, gown, apron. They all fall under personal protective equipment. Safe using and disposal of sharps. Safe usage and disposal of sharps, which means that once you use a particular sharp needle, especially injections, we need to make sure that after use, we don't use it, our nurses use it. So once they use it, just straight away, throw it in the biological hazard container. It's a hard bin, clinical bin, where all sharps go. And the maximum you could fill this particular sharps container is 75%. You cannot overfill it. The maximum you could fill this particular container with the sharps is 75%. You cannot completely fill the sharps container. Environmental cleaning, which is we have to do the regular cleaning, especially, how I was talking about handrails, doorknobs, these kind of things should be cleaned on a regular basis. Maybe, once in a day or depending on the policies of the organization. Now, moving to the next one, reprocessing reusable medical equipment and instruments. Example, you use a standing machine for one client. You take that standing machine to another client, clean it before you take it because you're using this equipment for different clients. Respiratory hygiene and cough etiquettes. Everyone knows what cough etiquettes are. Coughing or sneezing into your elbow. Aseptic techniques. We'll talk about aseptic techniques. Waste management. Okay. Waste management is, throwing away all the waste that, you may come across. It's not about the clinical waste, it's general waste. Handling linen. Okay. We'll talk about handling linen and aseptic techniques now. Let me go to that particular slide. And this is exactly what I was talking about earlier. Hygiene practices, respiratory hygiene practices. Now, these are the principles of asepsis: use of personal protective equipment, respiratory hygiene, cough etiquettes, environmental cleaning, safe use of sharps, sterilization and disinfectant of the patient care items and devices, appropriate handling of linen and waste. Now, most of the things that we have already discussed. But anyways, there is one other thing that falls under the asepsis technique. For example, which slide is it now? Standard precautions. Let's go back to the standard precaution. I'll just give you a little bit of information about asepsis technique. Now, when it comes to asepsis technique, now, for example, how we, in an aged care, we don't do it directly, but our nurses do assist our clients with wound especially wound that is, dressing needs to be changed or it's infected. They need to clean it and put some ointments and some kind of medication as per the doctor's advice. So they use a technique called asepsis technique, under which what they technically do is they clean the environment, okay, before they actually do the procedure. Everyone listen to me and ask me questions if you have any. Asepsis technique. When it comes to our own industry, you do have a question on this one too. Listen to me very carefully. So, for example, a nurse has to do wound dressing. She has to remove the old dressing and put a new dressing on. What they usually do is they clean the entire area, make sure that, there is it's clean. They limit the people. They don't want 4 or 5 people to be around them. Maybe a nurse and a personal care assistant, only 2 people. Okay. Now what they do is they have a dressing kit, which has sterile pack. Now sterile means, I'll give you a simple example. Now when you're working in aged care, near the wash basins, you have gloves. Okay. Can a nurse go and take those gloves and start assisting a client with the wound? Answer is no, because they have to use asepsis sterile techniques. Now, what is a sterile technique? There will be in this wound package, there will be one particular pack of gloves. There are only one pair of gloves, in simple words. What they do is they have washed their hands or they sanitize their hands. Then they open up that particular pack. They do not touch their mouth or body or anything else. They open the pack, they take the gloves and they put the sterile gloves on, and then they do not touch directly anything. There is something like a tongue. I can show it to you quickly, guys. Now, this is the pack that I'm talking about. Now, this is how it is. So it has a sterile gloves and it has some cotton. It has some tongs like this, and it has some cotton and other melilin and so on for dressing needs. So what they do is they open it up, they put the sterile gloves on, and then they take these tongs, they pick up this cotton, they dip it into normal saline or whatever is needed, and then they'll clean the wound, and then they do the proper dressing. Now, this technique is basically a sterile technique, which is a part of asepsis technique. Now, the reason behind why they do it is when the wound is open, what does it become? It is a portal of entry. In other words, microorganisms, any kind of microorganisms, bad microorganisms, could enter into the body of the resident because it's one of the portal of entry. Now, that's the reason we use asepsis technique to ensure that no bad bacteria enter into the client's body through this portal of entry. Am I clear on this? So that is a part of asepsis technique, which also falls under your standard precaution. Now, let's also look at the 5 moments of hand hygiene and also handling of linen. Now, when we're talking about handling of linen, everyone remember this, just in case if I ask you, slide number 39, you have these standard precautions. Now, handling of linen, and what was the other one? 5 moments of hand hygiene. Now, let's look at the 5 moments of hand hygiene. And I want everyone to write it down, please. What are the 5 moments of hand hygiene? And these 5 moments are according to the World Health Organization. Everyone, please write it down. The slide number is slide number, where am I? 57. Slide 57. Now, when do we wash our hands? 5 moments of hand hygiene. When do we perform the